Dr. Fawad. Today we're going to talk about sleep apnea. So I have lots of patients who come into my office with this condition. Now you may ask, well, what is sleep apnea? Well, sleep apnea in layman's terms is when you're not breathing so well at night. So how it's defined is a decrement in terms of breathing at a certain percentage, as well as cessation or impairment of breathing for at least 10 seconds. And so these are mathematically measured out when we do sleep studies. So what happens is when you breathe in, the airway collapses. So I always give the analogy of a child that's drinking out of a small juice box and utilizing a straw. We know that as the child gets closer towards the end of the juice box, the box collapses. And that's kind of what happens with sleep apnea. So what are the consequences of this as this happens over time? Well, over time, obviously you're going to annoy your significant other being right next to you, and you're going to be snoring very loudly. But things that you may notice are impairment in your memory. You may have an increase in your blood pressure. You may have an increase in your heart rate. But moreover, over time, what we do see is that there's increased risk of high blood pressure in the long run. There's increased risk of diabetes. There's increased risk of stroke. There's increased risk of heart attack. And there's increased risk of cancer, as well as other all causes of mortality as well. So if sleep apnea is not treated very well, then you are at risk for these things too as well. And then obviously it can also affect your memory too in the long run as well, which is a common complaint for people when they come over here. And you may ask, well, so what kinds of treatments are being done for this condition? The most common treatment is CPAP, which is just a fancy word for a box that blows air into, or essentially it's basically a box that's connected to a hose, that's connected to a mask that helps keep your airway open so that your airway doesn't collapse at nighttime. There are also oral appliances, and in some cases for some people there's also surgery too as well. And weight loss also is extremely important in terms of sleep apnea. So if this is something that you may potentially have, or somebody has been complaining about your snoring at night, then this is something that you should definitely have checked out. We look at this stuff all the time at Neuro Wellness, so if you feel like this is something that you have, please come into our office and schedule an appointment.